All right, let's see if this works a little bit better. I wonder if I actually had a mic hooked up. I wonder if that would work better. I've never tried that. Okay, so I'll just wait a couple seconds to see if you guys could find this feed here and see if this works, if the sound is working. It's better? Okay, good. Awesome. With this technology, you just never know, right? Okay, sounds good? Good, okay, awesome. So I'll just repeat what I said. It looks like the cat's out of the bag, guys. Low carb diets will shorten your life. It was on the news, so we know it's true. So I have to delete my videos and just tell people to start consuming carbohydrates in the form of breads and pastas. You can start eating your pizza now, guys, so we can actually, live longer. So, oh my gosh, I hope no one falls for this trick because it's a joke. If you actually look at the study, the first thing that I look at is conflict of interest. Two drug companies, Novartis and Zogenix, okay, two major drug companies sponsor this research, okay? Secondly, if you look at the carbohydrates that were involved, they use 40% carbohydrates. Yeah, we're recommending 5% of your total calories carbohydrates. 40% to me is a high carbohydrate diet. So right there, of course we know they're not going to live long, okay? Third thing, it was an observational study. It was based on a questionnaire that they gave people every every 5 years. Let me ask you a question. Can anyone tell me what they ate like 2 days ago? Let alone 5 years? No, I mean, we can't remember that long ago. So the point is that it's a joke. It's a total joke. If you really want to know what's the most important thing to increase longevity, it would be fasting, intermittent fasting. Hands down, that's way better than any type of diet. And that's why the combination is awesome. So I highly recommend it, guys. So, but yeah, it's total propaganda. It's fabrication. It's made out of thin air. It's a joke. All right, good. So I'm going to try to figure out how to answer any questions you guys have. All right. Right. So people smoked all day in the 80s. Yeah, they had, I mean, how are they going to determine from a questionnaire if it was the low carbs, even though it was the high carbs? Because the group that they're talking about, they had, some of them were pre-diabetic, diabetic, they smoked, they didn't exercise. I mean, there's all these other factors. So it's just totally just a joke. It's just, I mean, and people are getting all excited about it. I'm like, really? So that's not going to really do anything. All right, so videos on kidney damage. Well, here's what I would do, guys. I smell fresh cash. Okay, that's your ID name. You want to know about how to reverse kidney damage? Well, here's my viewpoint on that. There's 4 tissues that get destroyed with high sugar and prediabetes or even diabetes. The brain, the nervous system, the heart, and the kidneys. Okay, that's why diabetics end up with kidney dialysis. So I'm just going to recommend going right to the basic things. Do keto and healthy intermittent fasting. Actually, healthy ketosis and intermittent fasting. That's what I would do. I eat really high quality food. And what I mean by healthy is not just providing your nutrients, but the quality of food, having it very healthy. Even like a cow. If you take a cow and feed it grass, what it's supposed to consume, it does very, very well. As soon as the pH in that stomach, and they have 4 stomachs, the first stomach is 7, because that's the optimum pH for fermentation, apparently, in a cow, for that grass. When you actually switch it to grain, you drop the pH down to like 4.5 to 5. These cows were not I mean, their stomach wasn't designed to deal with that. So you're going to get infection. You're going to get all sorts of microbes and stuff. And that's probably one of the big reasons why they use antibiotics, which they can have some extra growth. And then over 70% of the antibiotics sold in the US are to animals too. So you really got to do organic because even if this is antibiotic free, you want it to say we never used antibiotics. That's really what you want. But the antibiotics are pretty bad because it's going to create a problem in your body eventually. All right, so yeah, what about toddlers with diabetes? Insane. Now, if they have type 2, we know it's just sugar. If it's type 1, it's probably from the vaccinations. I did a video on that. There's some people that didn't like me talking about that, but there's a lot of research. Okay, use ghee instead of butter. Yeah, you can use ghee instead of butter. Love from India, Dr. Berg. I have, India is my third most watched YouTube group. I'm going to have to come to India sometime. So we'll have to have like a seminar there, and I have to fly there just to say hello and talk to you guys because I would love to check that out. All right, butter's fine, but try to lower your fats to lose weight. The body will use your stored fat. Yeah, you're right. So I just did that video on that. So you can overdo it with the fat. Okay, so loving monk fruit. How much is too much? I don't think you can overdo it with monk fruit. It's pretty safe. It's actually a 0 on the glycemic index. Inflammation in the lower back. Okay, so what I would do, take your hands, press into the lower abdomen about an inch below the belly button, straight in, go to the left and to the right, until your back pain goes away. It's a little secret. To handle the muscles on the front part will handle the back part. Okay, so question, what time of the day is best for OMAD? Well, we basically work well. The best meal ideally would be probably in the evening, the first meal, just because there's a system that controls digestion called the parasympathetic, and it's called rest and digest. So during the day, if you're kind of like more sympathetic dominant and you eat, it's not going to be as good as if you actually can have it a little bit closer toward the evening, like maybe like 6 or 7. That would be the ideal scene, but it doesn't mean you can't switch it around. It's a minor point, but it is a point. I did a video on that. All right, so tell me something about the liver problems. Well, a lot of people have a fatty liver. If you have a gut, you have a fatty liver because the body's spilling over fat. And so it's important to do keto with a good amount of vegetables to kind of balance out some of this fat that comes off the fat, and it kind of has to come through the liver. So you want to clean it up. So that's important. Intermittent fasting is really important to restore the liver. If it's fat, you can add choline to strip off fat from the liver. You can do that, so that's cool. You can also add other B vitamins too, like nutritional yeast. That's really good for some of these B vitamins, like B2, B3, B6 are fat soluble. So some of the B vitamins, like B1, is water soluble. So some actually go deeper into the tissues. Some are more superficial. Dr. Berg talking about deleting videos. I was just kidding. That was sarcasm. I was saying basically, for those of you that are just coming on, that on the news, they just announced that low-carb diets found that you won't live as long. So you need a moderate carbohydrate diet. And I was just laughing at that because I'm like, okay, guys, we have to change our viewpoints because, it was on CNN. So we have to actually start eating more carbs. So let's go ahead and go for that. And I was being I had a dry sense of humor on that one. Okay, is there any possibility that someone gets hypoglycemia during ketosis? Well, only if you have hypoglycemia going into this, because what happens, think about this. We have we have insulin. And you take this heavy push down insulin wave out of the picture. And then your sugars might come up a little bit. But also, when you do intermittent fasting, you're eating up all this sugar. And then you burn fat, right? Well, then your blood sugar can come down. If you haven't fully adapted yet, what will happen, the adrenal will then kick in there and start making a little sugar, if it needs to, in the liver, okay? So if that happens, if your adrenals are weak and you don't make the sugar, it can come down a little bit. But I wouldn't worry about it, because after you do this for a bit, a normal blood sugar will be like 60 for you. Why? Because you're not running on sugar anymore. You're not running on sugar anymore. You don't need the sugar anymore. So it could be lower, but not, you can't run on completely, zero sugar, but our body, if it needs it, it will make it out of fat or sugar. How to lower cortisol? Well, if you have a present time body inflammatory injury, you got to get rid of that. But intermittent fasting will help reduce, it increases the capacity to handle stress, which is fascinating. You also want to go on long walks. You want to stop watching the news, especially CNN. You want to actually start to, if there's any type of mental stress, you're dealing with a chronic problem, worried about a problem, do something to handle that. Because the worst thing is to be stuck in a rock and a hard place where you're like stuck in a situation where you can't get out of. That's just going to be a chronic stress for you. And you'll find that your cortisol will be high. More sleep will help too. Okay, someone asked, what doctor should I seek in help for muscle stiffness in the legs, spasms, and keto? I need immediate help over 2 weeks. Well, I hope you're doing all the basic things. High quality electrolyte powder with a lot of potassium. You can try vitamin E and vitamin B, B1. Those really help. I would, honestly, for that, if you do all these things, including sea salt, and you still have a problem, then I would go see a clinical nutritionist, because going to the doctor for those type of things with keto, first of all, it'll probably discourage you from doing keto. Secondly, they're not skilled in nutrition. You want to go to the doctor if you have more of a medical disease or something like that, or you break a bone. All right, so Dr. Berg follows keto having a gallstone. Dr. Berg following keto having gallstone. Okay, that means you just need more bile salts. Get some bile salts. That's what you need. And keep your vegetables a little bit higher. Because what causes stones is high levels of insulin. How much is too much red meat so men can avoid gout? Well, I would do probably 5 ounces, 6 ounces. That's enough, That should be fine. Thyroid medication and keto, it's one of those things you're going to have to get in the basics and get someone that's good that can regulate your thyroid medication, because the need for it probably will go down after doing it. Okay, good. Can keto cause adrenal fatigue, or is that a myth? It's a total myth. It actually helps adrenal fatigue. Is xanthan gum safe? Yeah, but it can create some bloating in some people because it's a fiber. What about an endocrinologist? Yeah, those guys are the most arrogant. Some of these guys are so arrogant. I mean, they're kind of like, they're not really flexible in their thinking outside the box. I've been in practice 29 years, and I've had a lot of people that actually went to an endocrinologist, just didn't get help. They don't know, they don't look at food therapy. So that's just my viewpoint. Is MSG okay on keto? No, it's not okay on keto. It's going to spike your insulin. Dr. Berg, this is so hard for me because I work in diabetes endocrinology, and when my patients complain about their blood glucose and taking too much insulin, they say, I don't eat much. Well, you're stuck between rock and a hard place. I would work towards finding a job that aligns with your philosophy. Locally, there was this patient. She was an X-ray tech She was an X-ray tech, and no, she was a physician's assistant, and she helped gallbladder removals. Okay, and she came in as a patient, and she was just basically sharing all the video information with these patients until she finally says, I can't work here anymore. But it was definitely a problem because they were really just taking these gallbladders out left and right. Also, I had one of the doctors come in locally who was GYN doc, and he basically did surgeries on uteruses. Like, he was like the top doc in this area doing surgeries on uterus, taking him out. And guess what he came in with? Hot flashes. He was a guy, and I helped him, and I hope I influenced him. But you know, it's like, you got to find, there's more and more doctors that are more alternative, but I would try to find someone who's flexible in their thinking, who has some basic data on keto and intermittent fasting. There's a lot of them. You know, you can even get some consulting remotely with some of these docs. All right, Dr. Berg, I'm having high pulse, low blood pressure. Doctor claims I need more carbs. What, to lower your pulse rate and lower your blood pressure? Oh, you're getting low blood pressure. No, you need more sea salt, and you need B vitamins to lower the pulse rate. Not more carbs. All right, so what's your idea on turmeric causing kidney stones? Can we still take it? Sure. Okay, what is the fasting way to get into fat-burning ketosis? The fastest way. Don't eat. Fast, and you'll get into it, believe me. Okay, experience frequent tingling sensations in my arms and legs. Is it a sign of high cholesterol? No. You need B vitamins. B vitamins are going to be very essential in countering the peripheral neuropathies. Okay, I saw your video on coffee, increases ketones. Any update on that? No, I have to go back and do some more studying on that. All right, stevia was originally used as a whole leaf in coffee. Really? I didn't know that. Going to get a hiatal hernia surgery 2 weeks. Any advice? I would do intermittent fasting before, during, and after, and that will help heal that surgery. Should a diabetic medication be stopped during keto? I can't tell you to stop it. I would just get with your doctor, have them monitor your blood glucose and your insulin, and then make the changes as necessary as you improve. Because if your blood sugar comes down, then the need for medication will come down too, right? So I eat a lot of sheep liver. Is that good as a meal? I think it's awesome. Awesome. I wish I personally loved liver, because it's so good for you. All right, which foods contains the best source of B vitamins? Nutritional yeast, sunflower seeds, and also organ meats. Best way to cook eggs? Fried in butter over easy, with the yolk runny. All right. Okay, so what would cause upper right abdominal pain and discomfort? It's probably gallbladder and congestion. So you want to watch your nuts. I'm sorry, that sounded weird. You want to consume less nuts and seeds. You want to also increase your vegetables, and probably take something like a gallbladder formula to help give you bile and things to help you digest better. Okay? For heart failure, magnesium and potassium works well. Yes, John, you're right on. You want those electrolytes for heart arrhythmias, and then heart problems, and a lot of high quality vitamin C would work out good too, food-based. All right. Bariatric patients in IF, absolutely essential. I recently lost 35 pounds doing intermittent fasting for the past 6 months. No longer have high blood pressure. Wow, that's awesome. Hi, is there a ticket for the live stream for the Keto Summit? You can't attend. Now, I don't have, we may record it. It's not going to be a live stream. We may record it and sell it after the seminar, but we are going to be giving certain people transcripts, or actually the videos that we're going to record. But just realize that there's a lot of people coming from around the world, from Europe, from Australia, from Taiwan, from China. Like, they're flying in. This is going to be a huge event, one of the biggest. So hope you guys can make it. But you want to get more information, go to ketohealth.com. I would love to meet you guys in person. If you come on a Friday, so we can, because Friday night we're going to kind of do a meet and greet, and I'll be able to chat with people. There won't probably be everyone there, so it'll be awesome. So hope you guys can make it. I have like 1% left, so if it goes out, you know what happened. All right. Schizophrenia. I would do keto and intermittent fasting and see what happens. Yeah. Need a West Coast Keto Summit next year. Why don't you fly out over here? You're gonna make me fly out? Why don't you fly out? I don't want jet lag. No, I'm just kidding. All right, good. All right. Underweight, malnutrition, male, lower 20s. Yeah, you need to increase the quality of foods and do keto, but with a lot more fat, so you can start thriving. You need to really work on the digestion as well, so you make sure you can absorb the nutrients. I have a lot of videos on that. All right, guys, listen, thanks for your attention. I really appreciate that big time. Have a wonderful Tuesday, and I will talk to you real soon. Have a good one.